Hi everyone, welcome back to my channel Navjot Talks. My name is Navjot Sharma. I'm a registered nurse currently practicing in Ontario, Canada. Someone has asked me to make this video where I discuss the differences between working in the long-term care home and hospital. If you're working in the long-term care home, you know that you see the same faces almost every day. You have a particular shift assigned to you, morning shift, evening shift, night shift, or maybe you're casuals, you're working different shifts. But you know how it works in long-term care home. You have personal support workers that will help the residents to perform the activities of their daily living. Now let's talk about what type of people are there in the long-term care home. The long-term care homes are like the homes for elderly. When the old people are not able to perform the activities of the daily living by themselves in with that much efficiency, they sometimes need some assistance, like to put toothpaste on the brush, or to supervise them, or to help them in feeding. So that's the place, the long-term care home, where the old people will come and live the life like the home. That's why we have the name long-term care home. It will be their home. They will be assigned a particular area, like their room, their washroom, and they will live a life like they live in their home. They can choose their clothes to wear. They will very similar like we live in our home. But we have interdisciplinary care team members, like we have the doctor, we have the nurses, we have the social workers, we have the registered dietitians, and we have the food manager, we have the environmental manager. So it's like a home. It's a home that has 70 people living there, 80 people living there, and there are nurses who will help them for the medication, for the treatments. I started my career as an RPN in the long-term care home, and then I became an RN. I was an RN in the long-term care home. Then I became assistant director of care in the long-term care home. So I haven't worked in the hospital. That was my personal interest to choose the long-term care home. So these are like two different pathways. Maybe you're able to manage a long-term care home very easily, but you will find it very difficult to manage in the hospital. It could be the vice versa as well. Someone who has a lot of experience from the hospital, maybe 10 years of experience, might find it very difficult to adjust with the long-term care home, because they are totally different. The operations are totally different. How they are operated is totally different. Now let's talk about the hospitals. In the hospitals, you don't know who is going to be a patient today. In the hospital, it's more challenging. Sometimes the nurses, they have to perform all the job roles of the personal support workers. It's more critical because people are not going to their home. People are going to a health facility. They're going to the hospital where they need some sort of treatment. The doctors need to see them immediately sometimes. Emergency, cardiology. Like when it was COVID, people got pneumonia, people got bronchitis, people got respiratory symptoms. So that was the peak. So all the nurses, we had shortage of the nurses that time in the hospitals. In the hospitals, sometimes you will be asked to do 12-hour shift. Maybe you will be asked to do certain shifts, day shifts, and then maybe the next week you will be asked to do the evening shift. But you can choose in the long-term care home. You want to work morning, you want to work evening, or you want to work night. Some of the departments like dialysis, they do have hours like 8 to 4, 9 to 5. But majority of the departments in the hospital, they will ask you to rotate. Like you do 12 hours morning this week, or maybe 10 days you will do morning, and then you will do the evening. I have never worked in a hospital. I could be wrong in some points, but I have friends who are working in the hospital. So if we sometimes sit together and compare, then this is the basic differences we find, right? If we compare the wages, I think the wages in the hospital and long-term care home are not, it's not a very huge difference between the wages. It really depends how many years of experience you bring on the table from your back home country. Both the places like long-term care homes and the hospitals, they do consider your experience from the back home. Unionized positions. Let's talk about the unionized positions. The long-term care homes, we have unions in the long-term care homes, ONA, and then other unions. We have unions in the hospitals. So the nurses, they belong to this union. Anything happens to a nurse, that is something that she needs to talk to the union representatives, and she like advocate. So unions will advocate for the nurses in the long-term care homes, as well as the union which is dealing with the hospital will work for the nurses in the hospital. So they are two different, like there are a lot of differences. These are two different categories, working in the long-term care home, working in the hospital. So in the hospital, you meet with more challenging people, more patients. We call them patients, but we don't call patients in the long-term care home. Those are the residents because that's their home. In the hospital, you will perform more focused assessments. Like if you are a cardiac nurse, you will perform the cardiac assessment. But in the long-term care home, you will be asked to do all the assessments, the basic assessments. So because you are the first person, you are the immediate person available there with that particular resident in case of emergency. So you will do the cardiac assessment, you will do the respiratory assessment, you will do the neuro assessment. Every assessment will be performed by the same nurse. In the hospital, we have different departments. It's very fast to transfer the resident, the patient from this to that department. In the hospital, we have x-ray department, we have ultrasound department. That's where the patient goes to get the ultrasound and the x-ray or other whatever diagnostic test the doctor has ordered. In the long-term care home, we have x-ray people coming here, we have lab people coming here to do the lab work, to do the x-ray, to do the ultrasound, but we also send them to the hospital in case of an emergency. So whatever is an emergency, if we are not able to deal with that, we send them to hospital. But in the hospital, they have everything available in the same building, and they keep on transferring people from here and there and then get that work done in the same building, right? So this is a big basic difference. The salary is not a very huge difference. Depends where you're working. Some of the long-term care homes, they offer very good wages. Some of them, they have like it's their contract, it's their own way to offer the salary to the nurses. Whatever is in their agreement or whatever is in their unionized agreement, that's what they have to see. Same with the hospitals. Every hospital has different structure. Maybe you can get $2 more in this particular hospital compared to that hospital. Depends on where the hospital is located, what city the hospital is located, how many beds are there, and what type of patients it has, right? It really depends. So this was, I think, basic information which I could give you based on my knowledge, based on my experience. Please don't get offended if anybody is working in the hospital. You might find the things are really different. You can comment and just increase our knowledge, right? I'll see you in another video. Stay tuned. Don't forget to subscribe to my channel, and if you like my videos, press like button, and please don't forget to leave a comment. Whatever you want me to make the video in the future, I will be happy to help you. Have a good day. Bye.